If you're a physician who sees patients in the clinic regularly, you're bound to have seen patients with high blood pressure that's 180 over 100, 210 over 100 or higher. In these patients, it's imperative that you distinguish between hypertensive emergency and severe asymptomatic hypertension, formerly known as hypertensive urgency. At CME Travel Academy, at our conferences, we discuss the stepwise approach to be able to distinguish these patients, how to manage them, where to manage them, and what the workup should be. There's great data that shows that if you have patients that do not have hypertensive emergency, they do not need to be sent to the hospital. They do not need to be given acute blood pressure lowering medications. In fact, in these patients that are hypertensive urgency, which means that they do not have signs of end organ damage, meaning that they do not have signs of CNS symptoms, they don't have signs and symptoms of cardiovascular issues, they don't have renal problems, and they don't have any new retinopathy or papilledema. In those patients, you can safely manage them in the outpatient setting. If they have pre-existing hypertension, then restart them on their medications if they've been out of their medications and see them in 1 or 2 weeks. If the patients have other reasons for the blood pressure, such as severe pain from some trauma, or if they have some sort of anxiety or depression or like acute mental illness or substance abuse, then address those conditions. If the patient is newly diagnosed with hypertension, start them in two-drug therapy. Do the appropriate labs and EKG that we discuss, and see them back in 1 to 2 weeks. There's ample evidence that this is the safest way to manage these patients, and we really should not be sending those patients to the hospital or calling 911 or doing any acute blood pressure lowering interventions because they cause more harm than good. There's data from 50,000 patients that shows that these patients are safe at 10 days, 3 months, and even up to 6 months. So let's not do unnecessary things for our patients. Let's manage our patients with the latest evidence and guidelines. At CME Travel Academy, all our slides are referenced and cited with the national guidelines as well as the latest clinical trials. Come join us in 2026 for one of our in-person conferences, or if you prefer, one of our virtual live CME offerings. Again, this is Dr. Pule with CME Travel Academy. Come learn about hypertensive urgency and emergency at one of our upcoming conferences. Thank you again.